everyone, and welcome back to BDI Resourcing's YouTube channel. My name's Alice, and you might remember me from BDI Resourcing's social media. I used to help out with lots of different things across YouTube, Instagram and Facebook. Today I want to talk to you specifically about how to be successful in your job search with intensive care and anaesthetics in the NHS. One of the most common questions I get asked is it better to go into anaesthetics or is it better to go into ICU, and which one's easier to get a job in? And to be honest, there's no simple answer. Every single day I'm inundated with jobs across both. Sometimes we get positions at junior level, so that could be something like an SHO, even an FY2. Sometimes we get jobs at ST3 grade, and more often than not the positions that we work on here are at specialty doctor, specialist and consultant grade. It's not to say that there aren't positions at junior level roles, it's just that most NHS trusts are quite successful with their own recruitment at that level. There are lots and lots of anaesthetists and intensivists out there, so what I would say is my best advice is to be kind of open across both. If you're an intensivist, of course apply for intensive care positions. If you're trained in anaesthetics and you're passionate about anaesthetics, apply for anaesthetics positions. There's no need to apply for a different position in a different role just because you think it might be easier or there might be more jobs there. Probably the second most common question I get asked is, how should I get my GMC? As an anaesthetist or an intensivist, what's the best exam that I can take? And to be honest, you can take a lot of different exams and they won't affect too much on what sort of position that you can get. What I would say is if you're a more junior doctor and you're looking to get your GMC, potentially the best option for you could be your PLAB exams. Of course, once you've got your GMC through your PLAB 1 and your PLAB 2 exams, the positions that you will be applying for tend to be more junior, so things below ST3. If you're looking to practice at a more senior level within anaesthetics or intensive care, I would always advise considering other options. Now this can include the European diplomas, so for anaesthetics specifically I'd advise doing the EDAKE exam, so that's the European Diploma of Anaesthetics and Intensive Care. You can use that one as well for intensive care as well, so it's not to say that just because you're an anaesthetist you should do the EDAKE exams. You can also do them and become an intensivist within the NHS. A route specific to intensive care that looks absolutely brilliant on a CV is the European Diploma of Intensive Care, so that's the EDIC examinations. In intensive care as well, you've also got the MRCP examination route. Recently as well, another question that has come my way is the FCPS examination. So that's the Fellowship of the College of Physicians in Pakistan. Unfortunately, the FCPS anaesthesia examination has now been taken off the GMC recognised qualifications list. So if you've already got your FCPS and you've gone through the process of GMC, you're absolutely fine. We can certainly look at positions within the NHS for yourself. However, if you're currently working towards your FCPS or you haven't yet applied for your GMC and we're planning on using that qualification, unfortunately it's no longer a route that you can take. So I consider other options such as the European diplomas. At this stage, potentially PLAB could be an option, and of course if you're an anaesthetist, I'd say by far the most recognised qualification that you can take is FRCA. It's important to acknowledge that when you're looking on NHS jobs and track jobs, every single job that you come across in anaesthetics and intensive care will have a different divide in the rota. And what I mean by that is if you're an intensivist but you require no anaesthetics, there are going to be certain jobs that are going to be suitable and unfortunately others that are not. The same applies for anaesthetics. In most anaesthetics roles in the NHS, you will be expected to do some form of intensive care. Normally the split would tend to be around 70-30 or 80-20. But that's not always the case, so it's very important that you look into that. I'd say very recently I've worked with a fantastic trust who are looking for specialty doctors to cover both departments, so ICU and anaesthetics, and that would be where you would be able to speak to myself and say what is the rota, and I could break it down for you in more detail. So if you do have any questions on specific roles that you see on the NHS Jobs website or even the Track Jobs website, and you'd like an explanation of how the rota might work and what exposures you need to have had to apply for that position, do get in touch and I'd be more than happy to advise. Often I get approached by consultant anaesthetists that subspecialise in things like cardiac or advanced paediatrics or neurology. Other times I get approached by intensivists that specifically want roles in ECMO centres or liver transplant centres. Now it's important to acknowledge, especially when you're looking for your first role in the NHS, to be flexible, because not every single NHS trust will offer those really niche subspecialties, and often they won't have any requirements in those areas. So if you're looking to subspecialise in the future in the UK in one of these really niche areas like cardiac anaesthesia, then my best advice is to enter into a more general role and then progress within that department when they have the need for a cardiac anaesthetist. So my best bit of advice is that you can specialise in the NHS, of course, especially when you're working towards things like CESR and your specialist registration. However, within your first NHS role, if you're already practising as a cardiac anaesthetist overseas and you're looking for a very similar role, the best route is to go into a more general role and then subspecialise once you've got maybe a year of experience within the NHS. Something I know that is a very popular topic across all of the specialties that we work within, but specifically in anaesthetics and intensive care, is how much support and how easy is it going to be for me to get CESR in the NHS? And unfortunately, it is not an easy process, I'm going to be totally honest with you. There is so much work that goes into a CESR application, again, across all of the specialties. In anaesthetics and intensive care, you must rotate within certain niche subspecialties, and you need to have those exposures and competencies signed off to get your specialist registration and therefore become a consultant in the NHS. Now, it's never going to be easy, but it certainly is possible. A lot of trusts in the NHS will certainly support the CESR process. It's important to acknowledge that some trusts might be able to support it, certainly more than others. When I work with an anaesthetist or an intensivist that is looking to work towards their CESR, what we'll look into is whether a trust can support it through an educational supervisor. They might be able to give you extra PAs for research. They might even be able to give you rotations in those niche areas like cardiac. Advanced paediatrics is a very, very difficult one to get signed off as well. It's also important to acknowledge that it's very rare to get a position within the NHS or within a trust that will be able to offer you all of the competencies within the same role. So my best advice for you, again, would to be start off in a general role, get all of your general advanced competencies signed off, and then with areas like cardiac, neuro, even liver, advanced paediatrics, transplant, things like that. Those are where you're going to either need a secondment or you're going to need time away from the trust to kind of take time out of your rota to do those specific things. So it's something that you could certainly negotiate within a rota through myself. Look out for things like CESR programs, they do come up. I'm currently working on a few opportunities in both intensive care and anaesthetics that would be able to give you more ingrained CESR support if that's something that you're looking for. It is certainly possible to complete CESR in the NHS. My best advice as well is if you're coming from a senior role overseas is to begin collecting all of that documents overseas, get as much signed off as you can, things like logbooks, letters, patient feedbacks, bring them with you for your first role within the NHS and show your educational supervisor what you've already got, and they will then be able to advise you on what they can do for you. Okay, there is so much advice I have to give across the board for any doctor looking to relocate to the UK. However, my top tip for anaesthetists and intensivists coming to work within the NHS, my number one bit of advice is be flexible. And not only do I mean here on the specialty that you're going into and maybe the area that you're practicing within, but I also mean within the location. It's very often that sometimes we get a position in Wales, but a doctor specifically wants to go to London, or vice versa. I think the hardest part of the whole process when you're working up to becoming a consultant or even just wanting to progress your career in the UK is getting your first UK position. That is the hardest step. So if you are open and you are flexible to things like location, things like different exposures, so if you're looking for a 50-50 role but the rota is actually 60-40, be flexible, really take into account that this is going to be the most difficult step for you. And if it fits all of your other criteria, I would certainly say go for it. Do the first 12 months, see how you feel. You might absolutely love the post, or if not, you can always change trust, you can always move on. And getting your second position within the NHS is always going to be much easier. So being flexible is going to do yourself a huge favour. It's going to make the process a lot quicker. And again, be flexible on the grade. It's very, very easy to assume that because you've been maybe a consultant or a specialty doctor or even a registrar overseas, that that's where you should land within the NHS. But of course, it's important to acknowledge that the NHS is so different to healthcare's everywhere. Every single healthcare system around the globe is different, and the NHS is no exception. So to step into the NHS at the same grade you're practicing at, it might be very difficult, it might be very challenging, it might be very stressful for you. What we want to do is make sure that when you enter into the NHS, it's easy, the transition is smooth. So if you're practicing as a consultant overseas, one of my top bits of advice would be potentially be flexible in taking something like a specialty doctor, specialty registrar position, just so you're comfortable. After 6 months, you will probably get the option to then step back up, but just be flexible. Grade, location, clinical specialties, exposures, rota. It's important to be as flexible as you can. Thank you so much for watching. If you're an anaesthetist or an intensivist looking for a role within the NHS, then we can certainly help at BDI Resourcing. If you're looking to go through the CESR process and you would like advice on how to start, how to continue, or how to find support within the NHS, we can also help by sending across some specialty guidance or some blogs and vlogs that we've done previously. Alternatively, if you'd like to send across your CV, you'd like advice on where to go, what to be applying for, more than happy to help. If you have any friends, colleagues or family that are also interested in relocating to the NHS, just get in touch. Our email address will be at the end of this video, and thanks again, thanks so much for watching.